Well, I think we'll make a start. We've got 30 people in the room, which is great. So very warm welcome to this afternoon's online talk as part of our Past and Present series at the Foundling Museum. I'm Narissa Tatum and I manage the public programme for the museum. And I'm really delighted to welcome Dr Claire Phillips today to give a talk on medical care in the London Foundling Hospital, 1741 to 1800. And Claire and I have just been talking. She is in the midst of writing a book on the subject and will be at the Foundling Museum next week looking at the oral histories in the 20th century. So it's really great to welcome Claire all the way from Aberystwyth this morning. Just a couple of reminders. So we will be recording this session. For anyone who misses today, we can send a recording, and likewise we will be putting this recording on our YouTube channel. If you are enjoying the series, please do consider joining us for our next one, and I'll give the details of that at the end of this talk. But thank you again for joining us this lunchtime. Claire Phillips received her PhD from the University of Leeds in 2017, and as I said, is currently writing a book on medical care in the Foundling Hospital in the 18th century. Her wider research covers the Foundling Hospital from the 18th to the 20th centuries. Claire is currently an associate lecturer and an honorary researcher at the Open University. So thank you, Claire, and I will hand over to you. Actually, sorry, one more thing before I go. We would love you to ask some questions. We had a very lively debate last week. So please use the Q&A function and the chat function below, and I will chair that discussion at the end of Claire's talk. But please do chip in. We do love to hear from you. Thanks, Claire.
All right, thank you. Just apologies in advance. The RAF have decided that they're going to do flybys. They've just started. So if you can hear that, apologies for that. All right, so thanks everyone for coming today, and thanks to the Foundling Museum for inviting me to talk about my research. So today I'm going to talk about the medical care that's provided to children in the London Foundling Hospital in the 18th century. And I'm talking about care in its broadest sense. So it's not just about the medical treatment that children got when they were sick, but the overall care that was given. The medical records of the Foundling Hospital are housed in the London Metropolitan Archives, and they're freely available. So if anybody wants to go and look at them, they are there for you to look at. They're both fascinating and heartbreaking at the same time. And like we said, this research is the basis of my forthcoming book, although exactly when this book will be forthcoming is anyone's guess, hopefully early next year. So what I'm going to do today is give you a bit of a whistle-stop tour of the Foundling Hospital and the medical care. And obviously, if anybody wants to know more, I'll be happy to expand on things in the question session. So in general, medical care of children exploded in the 18th century, with a number of medical treatises being written specifically on childhood. The main concern was that everything was to be kept in balance. So humours and non-naturals were the two big aspects of medical care during the early modern period. And if everything was in balance, everybody was healthy. Imbalance of one of these humours or one of the non-naturals meant that illness would occur. But because children were children, the link between them and their adult carer, usually their mother or their nurse, but sometimes also their father, was also a point of contention in terms of medical care. A child was thought to be predisposed to ill health if a parent or a nurse was unhealthy or immoral. When a child was examined by a medical man, it was their size and their constitution rather than their age that was noted the most. Were they fat and ruddy-faced, or were they slim and of fair complexion? Did they enjoy a balanced diet, or did they have an unhealthy diet? So it was a lot of things like that. But in general, infants and children were thought of as being weak. 17th century midwife Jane Sharp noted that if children were to be swaddled, they had to be swaddled gently. The limbs needed to be bound straight or they would become crooked. And medical men, such as William Cadogan and William Buchan, who I'll talk about in a little while, said clothes couldn't fit too tightly or it would prevent the child from gaining strength. Infectious diseases spread throughout the 18th century, and some of these diseases were considered to be children's diseases. And this is because when somebody survived something like smallpox, measles, or whooping cough, they were then considered to be immune to it. So they would survive it as children and then grow up to become immune adults. And that made these diseases cyclical, and it affected largely only children, although you did get adults who didn't have these diseases as children. So this gives you a very brief overview of the medical ideas of childhood during the 18th century. But it does give you an idea of what kind of focus there was on children and how children were treated throughout the period. Upon admittance to the Foundling Hospital, children had to be healthy. As part of the admittance process, children underwent a medical examination, and if they were found to have any kind of illness, particularly an infectious illness, such as smallpox, measles, whooping cough, or scarlet fever, then they were refused admittance. But despite this, there are a lot of diseases and indeed disabilities that cannot be seen when simply looking at a child. And this medical examination that was undertaken was simply looking at the child. So children were admitted if they looked healthy, and sometimes they were not. Although for most of the hospital's history, admittance was strongly regulated, during the years 1756 to 1760, the general reception allowed children to be admitted regardless of their state of health. And that meant that the Foundling Hospital then had to deal with the children who suffered from a range of physical and mental problems throughout their childhood, and even sometimes throughout their lives. The general reception led to many children being admitted with venereal disease, and as Gillian Pugh, who wrote London's Forgotten Children notes, several nurses reported having syphilis passed on to them whilst breastfeeding the infected foundlings. But even though this happened, the health of the children did remain a priority for the Foundling Hospital throughout its existence, although large numbers of children did still die whilst under the hospital's care. The admittance of any child presented during the general reception led to the opening of a number of branch hospitals. You've got Ackworth in Yorkshire, which is where all the physically and mentally disabled children were sent. But there were also branches in Shrewsbury, in Barnet in Hertfordshire, Aylesbury in Buckinghamshire, in Chester, and in Westerham. Children were moved around depending on space and upon need. Children in the Foundling Hospital undertook work, and even in Ackworth, where there were these physically and mentally disabled children, there was a manufactory that provided the hospital and all the branches with cotton, with clothing, and they actually sold their wares in the local community too. So children needed to be of a minimum level of health in order to assist in paying their way, but the children were moved around as and when extra help was needed in different hospitals. But even if we've got all of these children who entered the Foundling Hospital healthy, children get sick. It's just what happens. And you've got lots of children coming and living in the same space, and this allowed illnesses to spread rapidly due to the differences in everyone's disease profile. So if you think about how many kids get sick when they go back to school, the first couple of weeks of term, everybody's always got colds and coughs, and it's the same kind of thing. You put in all these children together, it's going to spread. Children are going to get these common coughs and colds and other minor infections. But in the 18th century, they're also going to be at risk for smallpox, for measles, whooping cough, scarlet fever, the king's evil, ringworm, and a whole host of other diseases. Some of these diseases could and did kill. Others left children disabled. Measles and smallpox could blind a child, or it could cause deafness, along with leaving horrible scarring. Lady Mary Wortley Montagu, who is widely credited, rightly or wrongly, with bringing inoculation to Britain, was so badly scarred by the smallpox that she wanted to protect her children, and therefore other children, from this horrible disease. So like I say, children underwent a medical examination to get into the Foundling Hospital. They were then renamed and baptized regardless of their name or baptism status when they arrived. The babies were then swiftly sent out to nurse, where they would remain until they were about 5 years old, and they often became part of the nurse's family. Whilst at nurse, the foundlings mingled with other children. That was other foundlings that were being cared for by the same nurse. The biological children of the nurse could be there, and then there was local children as well. So the foundlings really were in a position to catch whatever illnesses were going around, and they did. Whilst at nurse, children were under the care of a local inspector, and the nurses reported to the inspector. The inspector then reported back to the Foundling Hospital. And quite often in these letters, we see mention of illness and how the children were treated. Most children were treated by their nurse just in the home, but if that didn't work, the inspector could then authorize physician or apothecary care. In extreme cases, the Foundling Hospital insisted on the children being returned to London, but whether really sick children would have survived the journey is unclear. One of the cases reported medical care via a number of means is that of Catherine Towse. Her inspector, Mrs. Birch, wrote frequently of Catherine's condition to the Foundling Hospital, and so we can use these letters to trace the care that Catherine experienced. Catherine was 5 years of age when she became ill at nurse in Berkshire. In 1759, she was reported as being sick with fever. She had been given magnesia and musk in order to prevent convulsions. Her fever continued for a period of 1 year, during which time there was some improvement noted in her condition. By April 1760, Catherine was reported to have been in great danger with a violent fever, but had recovered after being given James's fever powder. By 1761, however, Catherine was once again dangerously ill with fever, which this time was occasioned by cutting teeth. Catherine remained with her nurse throughout this period and was attended by a local apothecary rather than being returned to the Foundling Hospital. But she died as a result of a fever on July 5th, 1761. The records show that Mrs. Birch had a strong hand in Catherine's treatment, but she was not present when Catherine died. She did, however, express regret for this, writing, "I wish with all my heart I had been on the spot to have given James's powder, having with all the children so often experienced its efficiency. She died of a fever of which she was taken ill soon after I left the country." Mrs. Birch wrote to the Foundling Hospital about the health of several more of her foundlings, indicating her concern for those under her care. On the 6th of May, 1760, Charles Westcourt made his first appearance in Mrs. Birch's letters. Whilst the rest of the children under her care were tolerably well and some of them very thriving, this was not the case for Charles. It would appear that Mrs. Birch had already informed the Foundling Hospital of Charles's illness, although all that is mentioned in this letter is that, quote, "The child Charles Westcourt hath no other bad symptoms at present but what I advise the hospital of. He appears healthy, and I think it would be wrong to deprive him of the breast and country air. But if the symptoms should increase, I shall obey the directions of the hospital sent me by Mr. Birch." What these directions were is unclear, but perhaps, as Mrs. Birch has mentioned, air in the country and wet nursing, the hospital may have requested that Charles be sent back to London for further treatment. That Mrs. Birch would only follow these instructions if Charles's condition worsened suggests that she felt the wet nursing and the country air preferable to the conditions in London, despite the fact that Charles would have received physician-led treatment there. On the 8th of October, 1761, Charles was recorded as being in a very poor way. Mrs. Birch wrote that she was positive his nurse is a good one, and yet he cannot stand alone, and he has every symptom of an unhealthy, rickety child. The cold bathing water had been tried for some months, but without any effect. Some time ago, he had a large swelling on his arm, which, without a surgeon, was simply poulticed and dispersed, by which it appears the child has some bad humour in his blood. The magnesia has been given, but I fear he, with great difficulty, will be reared. On the 26th of March, 1762, she wrote again, the child, Charles Westcourt, was suddenly taken in a few minutes with a violent hiccup and died suddenly within quarter of an hour. I have been to Sunningwell and examined the child, but find no mark of accident or anything that could account for his death. If you remember, I suspected him to have been in a bad way for some months. The directions your apothecary sent been observed for some time, and the nurse thought he was getting better as he began to walk and grew fat. So these letters from inspectors give us an idea of how the children were treated when they got sick whilst at nurse. We can see that inspectors were responsible for ensuring children were healthy, and they approved intervention by apothecaries or physicians, as well as providing medicines such as James's powder when it was felt necessary. When children returned to the Foundling Hospital around age 5, it was like going back to school again. So all the children would have been mixing, passing their germs, coughs and colds around all to each other again. But it was not just movement of children from nurse to London that caused illness. Movement between various branch hospitals also moved the infectious diseases such as measles around. A letter from Dr. Lee to Taylor White on the 30th of May, 1763, suggested that moving the children was causing a measles outbreak. Dr. Lee wrote, I am afraid to remove any children at present from their nurseries, for this infectious distemper, which we now suffer by at the hospital, is in every part of the country and round about. I fear we sent it to Shrewsbury by the cart caravan. There we were then totally ignorant of it. They write 4 of the children which came down have the measles, which is the illness which this distemper resembles. I can't think it worthwhile to venture for such a dangerous infection into Yorkshire for the saving the additional expenses of nursing for a few weeks, but I think it is better to suspend the removal of any children till by the change of the weather the sickness abates. So the hospital was afraid of moving children from one branch to another where illnesses were rife, although at first they hadn't actually realised that this would spread the disease. Perhaps a child with measles who was not yet showing symptoms was moved, and so the disease had not yet been identified. But it shows how quickly these types of childhood diseases can spread throughout an institution full of children. The records of the various Foundling Hospital infirmaries show the number of illnesses that children suffered from, and they also help us to identify outbreaks of epidemics such as measles, smallpox, and a range of other diseases, including things like the itch. The itch was one of the more common illnesses in the Foundling Hospital. In most of the infirmary records, the itch is represented with 1 or 2 children at a time. However, large outbreaks did occur. In April of 1765 alone, 280 children were admitted to the Ackworth Branch Infirmary suffering with the itch. And considering there were 330 children in the infirmary at that time, it just shows you how infectious this disease was and how many children it actually affected at any given time. We don't actually know much about the day-to-day treatments that the children received in the Foundling Hospital. The records of the apothecary and the physicians are limited, and they're often written in either Latin or a form of shorthand or just appalling physician handwriting. And I honestly don't know which one it is in this picture. It could be all three. So if anyone is able to decipher this, I've got hundreds of pictures of the infirmary books. But we do know that children were placed into the hospital infirmary when they got sick. And we know that there were elements of isolation for infectious diseases. And we know that the staff in the infirmary did attempt to provide comfort to the sick children where this was possible. We know how children were likely to be treated, though. And we know this through the writings of several physicians who worked at the Foundling Hospital at various points throughout the 18th century. And I'm going to look at two of these individuals now. We've got William Cadogan and William Buchan. Cadogan wrote an essay upon nursing and the management of children from their birth to 3 years of age in 1748. And this was based on his observations in the Foundling Hospital. Prior to his work in the Foundling Hospital, William Cadogan was a physician at Bristol Royal Infirmary, and from 1747, he was a governor at the Foundling Hospital. He was concerned by how the children were cared for at the hospital, so he wrote a long letter detailing his concerns. This long letter was then adapted to be published as his essay upon nursing and management of children from their birth to 3 years of age. The essay went through at least 10 editions throughout the 18th century, so it was clearly very popular, and it was used outside of the Foundling Hospital as well. The start of the essay highlighted the number of children who had died before the age of 5, and Cadogan's aim was to offer a way of caring for children which did not lead to half of them dying before the age of 5. He wrote that children in general are overclothed, overfed, and fed and clothed improperly. The text went on to provide the nurses and the governors of the Foundling Hospital with a new and improved way of caring for the foundlings. William Buchan began his career in the Ackworth branch of the Foundling Hospital. He wrote Domestic Medicine, a book that was reprinted many times over the course of the following 100 years and was printed as far away as America. Buchan was very much of the opinion that women, particularly poor women, did not know how to care for their children. And the general gist of domestic medicine is teaching women how to care for their families. In the preface to the 7th edition of his Domestic Medicine, Buchan noted that whenever I had it in my power to place the foundling children under the care of proper nurses, to instruct these nurses in their duty, and to be satisfied that they performed it, very few of them, the children, died. But when from distance of place and other unavoidable circumstances, the children were left to the sole care of mercenary nurses, without any person to instruct or superintend them, scarce any of them, the children, lived. So here, Buchan knows better than any of the nurses that were hired by the Foundling Hospital to care for its children. And in the 16th edition of his book, published in 1798, he said the following about Ackworth. I some time ago saw a very striking instance of the danger of substituting drying medicines in the place of cleanliness and wholesome food in the Foundling Hospital at Ackworth, where the children were grievously afflicted with scabbed heads and other cutaneous disorders. Upon inquiry, it was found that very little attention was paid either to the propriety or soundness of the provisions, and that cleanliness was totally neglected. Accordingly, it was advised that they should have more wholesome food and be kept thoroughly clean. This advice, however, was not followed. Buchan appears to have left the Foundling Hospital under some sort of shadow, but I've not really found out much about the precise circumstances. So whether he was actually angry with the hospital or genuinely believed his superior knowledge was not being followed, we're not entirely sure. But nevertheless, the idea of cleanliness and wholesome food were thought by many physicians during this time to have been the best type of preventative medicine. It was to keep children clean, well-fed, and their humours balanced, which all led to health. In reality, there wasn't much physicians could actually do in the 18th century. Antibiotics had not been discovered, and so attempting to balance the humours and the non-naturals was a key way of caring for children. Both of these men, along with others who worked at the Foundling Hospital during the 18th century, had exclusive access to children's bodies and children's diseases. And although most of the care identified by both of these men consisted of diet, fresh air, and cleanliness, they were considered to be at the forefront of children's medicine in the 18th century. Throughout the 18th century, medical experiments were conducted on foundlings. And I'm going to talk here about one in particular, and that's the smallpox inoculation, but there were others. William Watson, who undertook the smallpox inoculation experiment, also used electricity to try and cure a child who was paralysed. Apothecary Robert McClellan used Powis Wells water to treat skin conditions, and William Armstrong, the founder of the nearby dispensary for the infant poor, used hemlock to treat whooping cough. So the use of foundlings and poor children for medical tests, experiments, wasn't unusual, but it wasn't particularly very nice. Just to warn you, this section is unpleasant, but there's no graphic pictures or anything. This is the only picture that I've got, so there's nothing to worry about. You're not going to see anything horrible. So during the 18th century, it became possible to inoculate children against smallpox. The inoculation process was long and it was arduous. For at least 2 weeks prior to the inoculation event, patients were put on a regime. The regime was aimed at making the body as healthy as it could be, and it relied heavily on the 6 non-naturals. So it focused on a good diet, plenty of sleep, but not too much sleep. The patient was to get air, but not too much air, and it couldn't be too hot and it couldn't be too cold. They had to take moderate exercise as well. Obviously, the preparation was dependent on the health of the patient. Healthy patients needed far less preparation than unhealthy patients, and this is why the constitution of children was looked at by medical men. So after about a 2-week regime came the actual inoculation operation. When inoculation began, a small scratch was made, but in later inoculation procedures, this became a large cut and it was usually on the arm. Smallpox matter was taken from the pustules of a smallpox victim and was then placed into the scratch or the cut. Obviously, having a cut took more time to heal than a scratch, which meant the process took even longer. And at this point, all patients were infectious. They had an active dose of the smallpox, albeit in a milder form. The regime was then continued until the patient was no longer infectious and the wound was healed. Although inoculation was considered the safest prevention against smallpox, the fact that a patient was given a live dose of such a deadly disease was what made it a dangerous procedure. So William Watson, he wanted to shorten the procedure and he wanted to pin down what was the point at which the patient was inoculated. So what was the most effective part of the inoculation process so the rest of it could be taken away. His experiments on foundlings were in 2 phases. So in the first phase, there were 2 experiments, and each of these experiments contained 3 subgroups of children. The first group in Watson's first experiment, in addition to access to air and diet, were given, quote, powder consisting of 12 grains of jalap and 4 of calomel, end quote. The preparation was to be taken twice before inoculation and once afterwards, and no other medicines were used in the preparation. The second group of children were given 2 purges of infusion of senna and syrup of roses before the punctures were made, and 1 4 days after. The third group of children within this first experiment were inoculated without any kind of medical preparation at all. The second experiment undertaken by Watson included the same diet as the first, and in this second batch, the variolous matter used to inoculate children was different. The children were given only 4 grains of calomel as a preparation with no further additives. The second group of children in the second experiment took 2 doses of infusion of senna and syrup of roses twice before the incision was made and once after. And the third group, again, were not given any kind of medical preparation. For these children, it was diet and air, and that was thought to be sufficient. Some children became unwell and suffered large outbreaks of pustules, while some, having undertaken the exact same preparations and diet, escaped without any problems. So this aspect of Watson's experiment didn't find a preparatory regime that worked consistently for every child. As none of the regimes worked for each child, Watson may have come to the conclusion that each child was different and therefore needed a personalised regime for smallpox inoculation. Yet his experiments did suggest that a meat-free diet, cool, fresh air, and plenty of water were important aspects of the inoculation preparation. The second phase of Watson's experiment attempted to determine what type of smallpox matter was healthiest in the inoculation process. The variolous material had to be collected from smallpox victims, but was it better to use material from natural smallpox or inoculated smallpox? Watson used different types of this material when he conducted his experiments in order to ascertain what caused the most favourable and then what caused the worst outbreaks of pox on children. So different kinds of this variolous material were available, and the first group were given variolous matter, quote, in its ichorous or watery state, taken from a person who had the disease in what is called the natural way. His second experiment used, quote, purulent matter taken from the pustule of the inoculated smallpox. And the third used variolous matter, quote, from inoculation in its perfectly concocted state, taken from the inside of the hand of a strong, hard-skinned boy, where 2 or 3 pustules remained after the rest were dry. So this last one, the variolous matter, was not fresh, but it was from smallpox where the pox were drying, but there was still a little bit of freshness in there. The fact that the boy was strong and hard-skinned suggests that Watson thought the strength of the boy may have been transferred to the inoculated children and helped them survive the inoculation operation. So here, Watson is attempting to discern whether the variolous matter taken from someone suffering from natural smallpox or the inoculated smallpox produced more pox on the inoculated child. And his main focus appears to have been on whether the children were scarred or not as a result of this inoculation. The potential for scarring was a really significant concern for those who contracted smallpox, either naturally or via inoculation. Children with smallpox scarring often encountered difficulties in ensuring apprenticeships, because although it offered a visible sign of immunity, smallpox scarring was unpleasant to look at, and these children were therefore more difficult to place than those with little or no scarring. Watson's experiment established that the type of smallpox that was used in the inoculation operation was of no concern, as again, each child reacted differently to each of the types of the variolous material that was used. Watson's experiments were ultimately a failure, as he did not find a way to shorten the inoculation process. However, none of the children in the experiment died of smallpox, so it could be argued that he was successful in providing children with protection against a dangerous disease, albeit in the same way that inoculation had been carried out for decades. It was not until the development of Jenner's smallpox vaccination in 1796 that the process of protecting children became easier. It's not clear when the Foundling Hospital began vaccinating rather than inoculating its children, although there is evidence that inoculation was still occurring in 1799. But a document dated 1809 entitled Instructions Respecting Vaccination, written by the National Vaccine Establishment, was located in the Foundling Hospital archives, suggesting that by that date at least, vaccination had overtaken inoculation for the children of the Foundling Hospital. These instructions suggested that there was no need for the preparatory regime, nor did cathartics need to be given afterward. Thus, this vaccine did what Watson's inoculation trials were not able to do: provide protection against smallpox without spending time preparing for the operation and preparing the child both before and after infection with smallpox matter. So just to bring everything together, we've got this idea that all children were expected to be healthy when they entered the Foundling Hospital, with the exception of the general reception years. But not all diseases could be seen, and so children were admitted to the Foundling Hospital while they were sick. And when you put a lot of children together in a room, coughs, colds, and other ailments are going to break out. So the Foundling Hospital needed to care for its children, and although we might suggest that this care was primitive, it did the best it could do. Nurses were able to treat foundlings in their own homes, but the inspectors were there to help when it was needed. Physicians and apothecaries cared for children within the hospital itself, and again, they did what they could do. Experiments on children occurred, but they were done with the oversight of the governors. So children got sick, and the Foundling Hospital treated them as best they could. They tried to prevent diseases such as measles, whooping coughs, and fevers from spreading any further than absolutely necessary. And the access to children's bodies provided by the Foundling Hospital to medical men such as Cadogan, Buchan, and Watson allowed these men to think about and devise treatments for children's diseases. And so the Foundling Hospital, along with these medical men who treated the children, can be considered to have laid the foundations of paediatric medicine, which would then develop more fully in the following century. So thanks everyone for listening, and I'll happily answer any questions that you may have.
Thank you so much, Claire. That was absolutely fascinating. And actually quite moving to think about the contribution that those children made to paediatric care. And it sounds like the impact is probably not won't be fully known, I guess, until your book comes out, but it's definitely something for us to think about as children, as pioneers. Certainly something we haven't talked about before. So huge thanks for such a fascinating, fascinating talk. We have a few questions. Do we know what James's fever powder was?
Yes. Basically, James's fever powder was a mixture of antimony and phosphate of lime. It didn't actually do anything as far as we can see, but a lot of, that Mrs. Birch was saying that it worked really well. But I guess that's kind of wishful thinking more than anything else. It wasn't poisonous, although there are some mentions of arsenic being in there as well, which isn't particularly nice. So basically, it's a powder with a few different bits and pieces mixed in that is supposed to calm down any fever and any cough. So it's supposed to, line the gullet to stop coughs coming out.
Probably not recommended for COVID.
No.
We've had a question here from Virginia. Thank you so much for a great presentation. I was just lingering, I guess, on the pioneering work that the Foundling Hospital did. I believe it was Dr. Mead who convinced the governors to give the Foundling Hospital smallpox vaccinations at the end of the century, although many were sceptical of its benefits. I was wondering, since you've seen so many of the health records, if you could tell me what you think the motivations are behind giving the children the inoculations, particularly since most children wouldn't have got the inoculations until later.
I think it was literally to stop the disease spreading and to stop the children from dying. They couldn't isolate to the extent that was necessary to stop smallpox from spreading through the hospital. Even in the infirmary, children did share beds. So, 2 or 3 children to a bed was going to spread smallpox really quickly. And the best way to stop that was giving them the inoculation. They didn't have the space to have every child in an individual bed and perhaps in an individual room, which was probably what was going to be necessary. So they were inoculating the children simply to stop them all dying because they couldn't stop the spread of the disease in any other way.
Thank you. We've had a question here from Jan. Did Watson say his sample size in his experiments? Do we have a record of that?
Yes. So he wrote a book. I used the frontispiece of the book on that slide. I can't think off the top of my head how many children he used, but I think it was something like 60 odd children, maybe more. But he did have quite a large sample in using in children for this.
Thank you. There's a question here from Lucy who's asked, when did the idea of humours die out in medicine, please, which is quite fascinating.
Yeah, I mean, it's still around. So, if you hear your grandma talking about you being phlegmatic, they're talking about your humours. My grandma used to talk about it all the time. So it's still something that's kind of around. But in terms of actual professional medicine, it was in the 19th century. Germ theory started coming out, and that's when the idea of the humours was sort of overtaken by science. So sort of mid to late 19th century, but it does still hang around today when you hear older people especially talking about it.
Thank you. I have a question, which is, did anyone think about the ethical implications of testing on children? I realise that this is quite a modern phenomenon, but there must have been people at Foundling Hospital who were emotionally connected to these children in some way. Do we have any records about reactions to that?
The reactions to the smallpox and the Powerswell water are pretty okay because smallpox inoculation took so long to do and they did want to shorten that process. They knew the children were not going to die because the smallpox inoculation was going to protect them regardless. There is a little bit more concern when it comes to things like the electricity experiment. Watson did publish that, so that is available if anybody wants to read it. There were concerns about what shocking a child with electricity was actually doing to her. It went on for a long time. It was quite a long experiment. Armstrong, who used hemlock in the treatment for whooping cough, he was in the dispensary for the infant poor, so it wasn't the Foundling Hospital, but it wasn't far away from the Foundling Hospital. A lot of people complained to the extent that he had to publish his methodology. And he said that children who were treated with hemlock were less likely to die than the way the children were treated before he used hemlock. So he published saying that hemlock was, it wasn't pure hemlock, it was watered down hemlock, and it's an antispasmodic. So again, it stops the muscles in the chest from contracting when there is a cough. So it dulls the need to cough, so it stops the whooping cough. But we don't see his original numbers. We just see what he published and what he wanted everybody to see. There's no notebooks of his original experiments. So there was a lot of outcry about that because hemlock is poison. But he published this and he said, I'm doing it anyway, it's saving all these children, so what does it matter? And he was giving the medical care to poor families who couldn't afford better care for free. So parents were between a rock and a hard place, really. Do they let their child die of whooping cough, or do they let their child die of hemlock poisoning? So there was an outcry, but he just kept on doing it because people kept on wanting to protect their children as much as they could. So yeah, there was outcry, but not a massive amount.
Thank you. That was so fascinating. Have we got any more questions? If you have a question for Claire, please just put it in the chat or in the Q&A. Just make sure. I think that's everything. Thank you, Claire, for a really wonderful presentation, and we wish you the best of luck with the rest of your research and look forward to hearing more about when your book is published, and we'll definitely have you back to deliver a talk, hopefully in person, when that is published. And we'll see you on site next week at the Foundling. But thank you again for joining us. Thank you to everyone who's joined us today as well, wherever you are dialing in from, and we look forward to welcoming you back on the 1st of June for our next talk, Picturing Children at Work and Play, Moral and Metaphor at the Vauxhall Gardens and the Foundling Hospital, which is being delivered by Miriam Al-Jamil, and that's the 1st of June at 1 o'clock. If you sign up, we will send you the details. But thank you again, Claire, and I hope you all enjoy the rest of this sunny week. Thank you.
Thank you.
Bye.